Hello, and welcome to I Am Dad podcast with your fatherhood authority, Kenneth Braswell. 30 minutes of wisdom, information, resources, and nuggets to help you on your fatherhood journey. Or maybe you're just curious and want to hear some real talk about fatherhood, family, and the minds of men. Well, guess what? We got you too. Sit back, grab your pad and pen, and maybe even bring a little something to sip on. Enjoy 30 straight minutes of fatherhood, family, and fun with the fatherhood authority, Kenneth Braswell.
Welcome to I Am Dad podcast. I'm your host, Kenneth Braswell. Thank you for joining us for another insightful, provocative episode. We are cranking along such great guests over the last couple of weeks. I'm so glad to be back in the saddle because I took that little 4-week hiatus in August, and I've never ever done that in the 3.5 years of doing I Am Dad podcast. Have never taking off that time. And so taking off that has actually given me the ability to kind of reload, refresh, reach out to people that I've been kind of watching and seeing and wanting to get on the show. Like my guest today, Dena Barnwell. She is a dedicated public health researcher, educator, and storyteller whose work is helping redefine how we think about fatherhood in the perinatal space. As a doctor of public health candidate at Morgan State University and an instructor of Towson University, Dena brings a unique perspective that bridges research, education, and real-world impact, from training community health workers to shaping father-inclusive practices and initiatives like Georgia's Fathers Matter ATL. Dena is a tireless advocate for recognizing and supporting the mental, emotional, and practical needs of fathers, especially one of the most critical transitions in family life, the birth of a child. Let's bring Dena onto the stage and welcome her. How you doing today?
No, I'm great. How are you?
I'm doing fine. I cannot complain whatsoever. At least I try not to. It's Friday, and I'm gonna get you off. We're gonna have a great conversation, and then we're gonna get to our weekend. That's what we're gonna do. Listen, it's amazing that I don't think I've met you. Usually people that I see as much as I see you, I've met them somewhere before, especially since you are in Baltimore, right?
I am in Baltimore, yes.
Yeah, you're in the city. I'm sure you know some of my people in Baltimore. I'm sure you know Dr. David Miller.
Yes,
I'm sure you know Dr. Janice Stevenson.
and not yet. I will be looking
Oh
for
my
Dr.
goodness, you have to know Dr. Janice Stevenson. She is a powerhouse woman. She's a psychiatrist, but she does a lot of mental health work in the community. I can't remember the health center that she worked at during the Freddie Gray unrest. It was that center that she worked in that they vandalized and took all the medications and all of the drugs out of there. That was the one that she worked in. And so, but you need to know each other because you guys are in the same space. And so I'm going to make sure that I connect the two of you somehow so that you can talk. And then there's a bunch of other. James Worthy he was in Baltimore. I think he's in DC now. He might still be in Baltimore, but he's a Baltimore native. And I'm sure you know Joe Jones.
Of course, yes.
Right. And so there's no shortage of people that I know in Baltimore. I love Baltimore, and you guys are doing incredible, incredible work. And you should be really proud of yourselves for uplifting, particularly our community in Baltimore and more specifically fathers. Dena, we start our show off really interesting because we like to, because I'm nosy, but one, because I think it's a great start to the show. And I ask all my guests to tell me their daddy story. I don't try to frame it. Don't ask me from what perspective, because your daddy story is your daddy story. Whatever it is, that's the question today. Tell us your daddy story.
Yes, yes. I am, my daddy story is one of being a major daddy girl.
Ah,
My dad, he, from as far back as I can remember, I did everything with him. I could remember riding around Baltimore City. I feel like it's been long enough I can say this out loud. But he would drive a stick shift and he would steer and he would let me shift the gears and we would listened to George Clinton and the P Funk All Stars together in the car. And so I grew up my entire childhood having my father there, very involved, very active, very proud of me. And so that was just really normal for me. We did get an absence once I became an adult. There was an abrupt break in our contact with each other where we didn't speak for about a decade. And that's part of what actually brought me to fatherhood work
Mm.
because I knew that he wasn't involved. It wasn't, his absence just wasn't due to a lack of interest. I had 18 years of proof that he was more than proud to have a daughter and to be my father specifically. But something happened and it started making me think like maybe the issue, especially in places like Baltimore, isn't necessarily just a lack of desire. Are there other things that could be impacting fathers that might also impact their relationships with their children?
Hmm. Did you find out specifically what the abrupt was?
Yeah, so he was going through some personal issues on a spiritual level, but I would say it was mental health related.
Mm.
Things from his childhood growing up. He had a very serious childhood. He was the oldest of 10. He left home early to join the military so he could help support his mom and all his younger siblings. So he had quite a few things to work through himself. And then once I became an adult and he knew I was self sufficient, it kind of gave him that space to be like, I got some stuff I need to be dealing with. And
Mm.
so he needed that time.
Yeah, I was listening to, just happened to run across it the other day. It's an interview that Jay-Z had with Kevin Hart.
Mhm.
And they were talking about like understanding people, understanding and knowing their story. And Jay-Z, like I've never heard him talk about his father be heard before. I've heard stories about him, but I've never heard him speak about him. And he was just kind of talking about how like it's hard to know someone if you don't know their entire story and you don't try to understand it from their perspective. And he was laying out like what he knew about his father and the circumstance that he was in, and literally like walking through the perspectives of the people who were around him, his dad. And he said it gave him a whole nother look of his dad, where, throughout his life, opposite of you, there was this absent, but at least now he could explain it, right?
Mm.
And it
Yeah,
didn't add to his pain. It actually added to his joy of knowing that it wasn't me,
yeah,
right?
absolutely.
So what was the question you was trying to answer when you didn't know? And how were you trying to answer that question?
When I didn't know, as you mentioned in the case of Jay Z, I thought it was me. What did I do wrong?
Hmm.
Did I miss something? Um, because I didn't. It was so abrupt, and so of course it had to be my fault. um,
Hmm.
and you know, I actually didn't seek answers initially. I was just angry. And it wasn't until I got to a space where I'm like, maybe I should try to figure out what's going on. And that came with some maturity on my end. I think becoming a parent myself helped me understand um, that it's easier than it looks being a parent. And so taking having that space to ask questions, and then also my dad being in the space to being prepared to answer questions.
Hmm.
That also had to wait for him to be ready to even articulate what he was going through or be willing to share it. And so in listening to him and him actually telling me all these things, it just opened my mind up to what like parents are people. Who would have thought?
Wow. Yeah, and you're absolutely right. We just forget that they're human, right? Like, but I think it is because as children, we see our parents as superheroes, right? And particularly our fathers, it's like, how can a superhero leave me? I can't, you can't wrap your head around something that can impact a superhero, because everything that we know about superheroes says that they have superhuman strength,
Yeah.
right? They can withstand anything. And so when you find out that, our parents have, levels of vulnerability just like anybody else. And I think, to your point, yeah, our kids kind of bring us around to kind of recognizing that, oh, snap, like, I'm not superhuman,
Yeah.
right? And I have to kind of figure this thing out. But that led you into like research. Was that because you was making a connect between what happened to your dad and the dads you were seeing in your community?
Um, Actually, it came a different way.
Okay.
So how I actually got into fatherhood research was initially I spent my early 20s as a doula, birth and postpartum doula, and I would go and actually um, move in with families for 6 weeks and
Mm.
help them adjust to the transition of, that transition of becoming parents. And so when I got in a position to go to school, I initially went into child and maternal health. That was going to be my field. And during the process of doing all my research and papers for school, I started questioning, how can we talk about child and maternal health without a discussion of fathers?
Mm.
It didn't make sense to me that a major piece of that triangle was missing from the conversation. And so I started looking what is out there as it relates to fathers. Um, does anybody ever think about what fathers need? Or anybody ever asking them any questions? Because the transition, although they aren't going through potentially the physical transition of birthing a child, they are still taking on new responsibilities. Their relationship with their partners are changing. And as I've gone through research, I've learned that even their hormone levels are changing, their testosterone is dropping, like they're going through things as well. And so, is anybody asking these questions? And that's what led me to the research, because I'm I always like to focus on whose needs are being unmet, and we do have a long way to go with maternal and child health.
Hmm.
However, I noticed there was an even larger gap when it came to fathers.
Yeah, there's a lot of work being done out there now. It's interesting. I want to talk to you a few minutes about the doula piece of it. Because I remember when I started hearing that, a good friend of mine, Joel Austin, who's in Philadelphia, has an organization called Dads to Doulas. I think that's the name of his organization. And I remember interviewing him. I interviewed him on a podcast. It was like maybe 2 years ago. And I was like, dude, like, help me understand, like, what is it about this particular work that you think is fatherhood work? And he just started like talking about the importance of the presence, of fathers at that particular time as a support mechanism. And I had never thought about it in that way before. I guess because I'm thinking about it from a medical point of view. Like, we're not doctors, so what do we add in the room, in the waiting room, while she's waiting and being prepared, other than holding her hand? And then when he started explaining to me, he's like, and sometimes, for the guys in the room and even for the women, like, they need a male voice, particular if one is not there, right? Or they're not used to hearing a male's voice. And it was just intriguing to me. From your perspective, like, why is it so important that we engage fathers at that critical point of their children's development?
Well, from my perspective, any way you are including someone in the process, you are telling them your presence is necessary, it's valuable. And it doesn't only apply to that one situation. So if you make it clear that you're contributing in this space, it'll continue in the long term.
Hmm.
If at any time from preconception, because we even talk about, um, how the quality of a pregnancy is related to the preconception health of the fathers as well. So if you, at any point from preconception all the way through, the whole life of these children, if there is any space where you aren't including fathers, then you're setting a condition where you're telling them there's some spaces you belong and some spaces you don't. There's some spaces you have value and some spaces where you won't. I mean, that's not true. Fathers from before a child is even conceived is important. And so when we bring them into that space, not only are they there as a support for the mom, and as someone who is advocating for the mother, but it's also an outward sign to say, hey, you are valuable in this whole process here too. And then that will continue on throughout the whole child's life.
Now you say you moved in 6 weeks before. Walk me through the 6 weeks. Like what's happening in the 6 weeks?
So I moved in after the birth. So I would attend the birth and then I would move in after the birth and
Oh, okay.
stay with her for 6 weeks. And so during that time, it was anything these families needed. If there were other children in the house, it was supporting the care for those other children. It was nutritious meals for the moms. Everything, it was non-medical. So, not checking in the body or anything, but just making sure that this person is comfortable, is adjusting. A lot of people think that babies and come out already knowing like how to breastfeed, and that's a process. The babies and the moms have to learn this, and being a space, a person who can support through that transition, reassuring them that normal things are okay. Like baby pops up with acne, like babies get acne, it's okay. And so going through some of those things, it's almost just a reminder that you're doing okay, but then also some of those practical supports like laundry, again, like cooking, making sure that the family is adjusting well.
Mm. We in our curriculum, one of our modules centers on early childhood development, ages and stages, and things of that matter. And so, it's interesting because when the dads attend those classes, it's amazing, how much they don't know.
Mm.
And I often say to myself, like, it's interesting because with all the girls and around my life, daughters and stuff, like some of the same things they don't know. So, from an educator's perspective, like, where does the education occur if it's not happening in school?
So that is one of the things that I look at specifically. I look at that educational component. One of the things that we are finding out is that information needs to be made available before somebody needs it. However, most of the time, people are going to pay attention to something when they're actually in the thick of it.
Mm,
It I'm suggesting incorporating it in even college level courses. So I teach a sexuality course, and within that course, are talking about some of these things of because this is in a child is an outcome of those types of activities, and so teaching it to young people to age appropriate
mm,
based on what people need to know, but making that information available. I'm also encouraged when I see it portrayed more in the media. So when we have, for example, the movie with Kevin Hart and him it was a movie where he was taking care of a child. He was
oh,
like a
fatherhood,
father.
fatherhood.
Um, Movies like that, or even I catch a lot of flack for this, but even in Cardi B, she had a music video where she was breastfeeding her baby and showing everybody like, hey, you can do this. So showing these things in different ways, it doesn't have to be formal education, but the more we're exposed to things, the more we see it. A lot of times, the more it catches our interest,
Mm.
and then we dive deeper on our own. But if nobody actually exposes it to us in the first place, then oftentimes there isn't that desire to kind of dig deeper and learn more about certain topics.
Yeah, one of the things with, even with the whole notion now that teenage pregnancy is dropping, Like, I often wonder, why is it because the younger generation are just making more decisions about their own goals before they step into parenthood, or something else going on? Like, what is the phenomenon for that? Because, people have tried to attribute it to all of the kind of, just say no and, wear a condom and all that kind of stuff. I think it's something else. I'm not exactly sure what it is. I look at I have a 16-year-old. I have young kids as well. Between my 16, the next one is 24. And so, and my 24-year-old literally just waited to have a child last year. My 34-year-old has no children. My older children all have one. Um, and so from Amber on down, like, their mindset about that is very, very different. Like, they're all of them have always spoken about what they wanted to achieve in life, and that being the driving force to their life, as opposed to kind of not making the best decisions, even though you're an adult and you're out there in the world, to not bring children into the world before you were ready.
Yes, I will say I agree with you. I think there are a lot more opportunities, especially when we think about what has changed for women and what, opportunities we have access to. That has changed. And I would say it's all of the things. So there is increased education. We are talking about it more. There are more opportunities to prevent pregnancy. We're not talking like abstinence only anymore. We're letting people know you have options. And so I think when you combine all of these things, you do create a condition. I saw an article said that there's more women over 40 pregnant than teenagers, and it's the first time that that has ever occurred. So that is, like you said, people are saying, hey, I want to get some things accomplished first before I start having children. So, having those goals and setting their sights, I'm actually very encouraged.
Yeah, we're actually, as an agency, focusing a little bit in those early relationship stages. We know, research says a couple of things. One is that somewhere around 80% of low income couples are still romantically engaged at the birth of their child, right? And so for us, that's an opportunity point, right? It's an opportunity to kind of swoop in, and kind of do some education things while they still quote unquote in love, right? Or at least feeling each other. And then there is no significant difference between a non-married father and a married father by 1 year. However, by the fifth year, that non-married father is less likely to spend a significant time around their children. So something is happening between year 2 and 5. And I think it's life. Life is happening, right? And all of the things that come in to begin to start disrupting co-parenting relationships, specifically when they're not married, begin to become a factor in how long a father is around or how much they stay intimately engaged. You're also working specifically around the mental health component of this as well. What are some of the challenges that you're seeing out there specifically for fathers, as they're kind of going through this kind of prenatal process?
Mhm. There's quite a bit. When I just completed data collection on a project here in Baltimore where I asked some of the fathers not only their motivations for being involved, but what some of the challenges are. And one of the major challenges was related to mental health, but there's a lot of things that influence that. And so, kind of going through that transition into fatherhood, there's often just a lack of recognition for what they are experiencing. And because of that, they may have difficulty identifying resources
Mm.
to support them in that. There's also this general sense that men are supposed to just have it together. They're supposed to just kind of tough things out. You're not supposed to really ask for help. And so having that be the standard, there's also some who feel like they're accessory parents anyway, so they don't really have the right to not be well because they didn't carry the pregnancy. And so even some of them are downplaying their own ability to seek help. They think there shouldn't be anything wrong in the first place. And so when we talk about those mental health components, not to mention many fathers that I spoke with, they didn't even really have access to mental health services. So if they wanted to get help, they didn't know where to go, or potentially didn't have coverage for those types of services. And then for those who are going through situations where they're not with their child's mom, there's a whole other list of things. And so when the system becomes involved, some of the fathers feel like the system is weaponized against them.
Mhm.
Um, and some of them also experience that within like family courts, there is a power imbalance. And so they feel like they have to almost always walk on eggshells. They can't really address conflict directly because they're afraid of what the repercussions will be. So if something's happening and I try to address it, is this person going to get upset with me and then make it difficult for me to see my children?
Mhm.
And so without being able to directly address and resolve conflict, that can kind of grow in a person, and it can become chronic over time, where it starts to impact their mental health in a long term. So we know that there's a general um, kind of aversion to help seeking in certain communities, but we have seen some promise. So one of the things that we did with the research study was we created these kind of like focus groups, and they were father led. So it was all men's spaces, and they met in places like there was one session at a gym where they could have these conversations while they were working out. There was another one, of course, in the barbershop space because we love the barbershop.
Mhm.
And the fathers said that just being in this space with other fathers to talk about fatherhood topics, like they left the room feeling better about themselves, about their roles as fathers. They left with ideas of how to manage certain things or things that they can do with their own children. And so creating these even informal spaces where
Mhm.
fathers can come together and discuss topics that are important um, can be one of the things to contribute to improvements in mental health.
Yeah, I think one of the other missteps that we make when it comes to specifically stress is that whenever we talk about stress, we make it so singular, right? We talk about stress as it relates to the dad, or stress as it relates to mom, and sometimes stress as it relates to child. But just before we you started all this, you were talking about these lists of things that begin to happen. And I'm like, that stuff has to be looked through the lens of family stress. How is that affecting all three of them in ways that you have to pay attention to, right? Because just to work with him and not work with her doesn't do the child any benefit. Or just working with her and not working with him, or how backwards. That doesn't do anything for the child. When you think about those lists and you think about the stress factors and you think about this other thing, right, which is social expectations, right? Because you're weighted under these things that you're stressed about. And part of that stress is I can't get myself together enough to please how everyone in my life sees me or values me. Like, is this mental health thing like so complex that it is like really, really difficult to get to the root of finding a solution?
Um, I think it depends. I think there are, when we talk about stress and mental health, I mean, obviously the area of mental health specifically is not my area of expertise.
Hmm.
And but I've in the research I have found that it can be very complex. One of the things that what we have noticed, or some of the suggestions when we talk about fathers and families, is that sometimes we have to get very specific when we try to address these things. If you just go and ask a father, "Are you sad?" Um, then you might not get a quality response because sometimes men don't think in that sense. And so you might have to ask a very specific question about
Mhm.
a very specific topic, like are you experiencing a challenge as it relates to connecting with your child? Like sometimes you have to get specific
Mhm.
to have a place to start from. However, what you said was very important because we have to address the whole entire ecosystem. So,
Wow.
like you said, if we're only talking to fathers, if we're only talking to mothers, then we are not looking at the entire dynamic and how everything interplays. And so we know, for example, with postpartum depression, the when a father has symptoms of depression, then it's more likely for the mother to also have symptoms of postpartum depression and vice versa. So individual rates of postpartum depression in men and women um, are at one level, but if either partner has those symptoms, then it increases the risk for the other partner. So those rates begin to rise. And
Mhm.
so we know that there is a connection. And then when we talk about how that compounds and what that looks like in children. So when the parents are stressed, the children have poor externalizing behaviors. They might have internalizing behaviors. They might be more high strung, or they might have difficulty with emotional regulation. So as you said, we need to look at the entire system. I think some of the work that I've really tried to do is when I say father inclusive, um, because a lot of what has been available has been so child and maternal focused, making sure that it is father inclusive. So let's bring the entire family into this space and see what we can do to support everyone.
Yeah, we you know, have wrapped ourselves around this notion, um, that in many of these cases, um, father absence is a has a greater impact than these other issues, and they are the absence in and of itself is the stimulator for all of these other things happening. And so it's the premise of it's our premise that um, so we have a progressive change model at Fathers Incorporated, and this progressive change model is if I can impact how a father feels, I can impact how a father thinks. If I can impact how a father thinks, I can impact what a father does. But if I never address how he feels, I'm never going to get him to change his mind. And if I can't get him to change his mind, he's never going to engage in the behaviors that we have expectations of. And I think in the practitioner space, we are so shallow in how we help fathers that we always want to address their actions and correct their behavior in actions without ever knowing what they're thinking or what they're feeling.
And I'm glad you said that, and because it's very important that we go back. Like you said, instead of treating the symptom,
Hmm.
or at least that's what we think, because oftentimes we're not even treating it, we're kind of penalizing, um, the behaviors. However, when we think about how the fathers are feeling, one thing that I learned in this research study that is going on right now, the stories of Baltimore fathers,
Hmm.
we're specifically asking the fathers what motivates you to be
Hmm.
active and involved. So this is a study that only includes um, fathers who are actively involved in raising a child who's currently under the age of 18.
Hmm.
And so we're asking them, what motivates you? Why are you involved? And what we found is that fathers, they already, before they become fathers, many are already interested in being dads. They're already excited about it. They're already thinking about what legacy can I pass on to my children. They see their legacies in they said that they see their legacies in the choices that their children make, how healthy their children are, the partners their children pick, and they're very excited about passing on this legacy. And so, what I'm seeing in a lot of cases, the fathers, they already feel excited about their roles. In some ways, are there things happening that's kind of creating a barrier or challenge to them to their behaviors matching their desire. So sometimes there can be this disconnect where we have to actually help encourage and change the way they feel. But in some cases, the feeling is there, but there are barriers and challenges that may be happening along the way that creates a disconnect between how they feel and the outcomes, what the behavior turns out to be. And so a lot of times when I'm looking at the system, I'm looking at policies. Are there barriers that we can remove that can make it where these fathers can actually, live the type of lives they want to with their children and be active and engaged in the way? So I only bring that up because I wanted to just kind of highlight that for many of the dads, it's not them that needs to change.
Right.
Have the desire, they have the will, they want to be there, they're excited about it. And so, what can we do in the environment or either social expectations? I think as a mom, one thing I had to learn, I have a kid, he's 17 now. I had to learn how to let his dad parent in his dad's way. So, like, I think I saw this meme on Facebook where it's like a father, he's kind of tossing a child in the air, and then
Yeah.
from the child's perspective, and then from the mom's perspective. And so everything in me is like, don't toss him up there, he's gonna fall. But me, on some level, I'm trying to, tell him how to interact with, the kid.
Hmm.
So once I learned to relax, um, took that barrier away, then I was able to see their relationship kind of flourish even more than it already was. So that's just one of the things I look at. Are there barriers that we can remove that can help these fathers who already want to be involved do what they had in mind to do?
And that's so difficult, like when the relationship is not where it should be,
Yes.
right? Because there's this control factor in there, right? The control factor is, to your point now, what you would discuss or describing was, you know, somewhat control of your expectations or control of your perspective. This is how I see it. This is how I saw it. But sometimes that control and perspective becomes real control, right?
Yes.
It is not only do I not want you to do that, but if you keep doing it, I'm going to do the things that do not allow you to do it, right? And so it's we are applying for we already have the fire grant, the fatherhood grant from the federal government. But in this next iteration, we have also, we don't know if we're going to get it yet or not, but I have this theory, right? And so we also apply for the heart grant, which is the relationship grant.
Yes.
Our focus in the abstract of the grant is that we are not going to look at romantic relationships. We're going to look at co-parenting relationships. So the goal is not to get them hooked up, right? The goal is to get them to function in a healthy way. Now, if they get hooked up as a result of that, that's a bonus, right? If they
Yes.
get married as a result of that, that's a bonus. But the goal can't be the destination of marriage just because research says that that's the best case scenario, at least from a data perspective, for our children. Because marriage is not a destiny, it's a journey. And what makes relationship and marriage so beautiful is that everyone embraces the journey through it, right? And that's a hard thing to get through to people who are more concerned about the behavior of fathers than they are the condition of fathers.
Yes. I'm really glad that the focus is on the co-parenting relationships in general, rather than focus solely on let's have marriages,
Right.
right? Because yes, some of these co-parenting relationships resulted from romantic relationships that didn't work out. But if we're honest with ourselves, some people just get pregnant. Like may not have necessarily been a real relationship. I mean, we have all types of dynamics going on in our society, and I'm very interested to see what the research will show when we talk about um, healthy co-parenting relationships.
Hmm.
I know that prior research has shown the standard of marriage, and that's often, compared to disjointed households.
Hmm.
And so, if there are ways to support co-parenting relationships, can we still see a lot of those benefits if we can show, if we can support parents in working together?
Hmm.
That how instead of, like you said, the goal being let's get this family back together, because who knows, they could have other partners by now, what their dynamics are, but can we support them working together and how that will impact children overall? So I'm really interested in seeing where that research goes, because again, all our prior research is like either marriage or just like people who aren't working together.
Hmm.
Um, and so there are many different ways that what families can look like, and can we support with all those different iterations of family,
Yeah.
with working together.
Yeah. I interviewed someone for the podcast not too long ago, and he was talking about how um, he put himself on child support. And I
Mm,
said, "Why'd you do that?" And he said, "I wanted to remove the stigmatism of being placed on child support and fighting that uphill battle to always prove myself that I love my children. That if I walked in and said, 'Put me on child support so that this is not an issue, so that you know that this is not something I'm dodging,' I can focus more on being a parent than being a financial supporter." I've never heard anyone say that before, and I was like, "Whoa." So I asked him, I said, "So how did it work out for you? What was the relationship like in court?" He said, "It was beautiful all the way through because the judge actually became my advocate because she didn't have to always try to figure out whether or not I was trying to dodge something."
mm,
Said, "I never missed a child support payment. I never missed a court date. I never missed a doctor's appointment. I never," he says, "now I had to prove myself up front. It had to be a strategy to do that, but that wasn't the push to be that. I wanted to be that naturally, but I knew that there was a system in place that I had to overcome in order to get there." And he said that in the first few years, like his relationship with the mother of his child was kind of really rocky. And after a few years, when she realized what was going on, that this guy's really not trying to, and I can't get over on his court, I can't get over on I can't control him. She
yeah.
began to start coming around, and now he has an awesome relationship together because they've figured out how to co-parent, how to coexist. I think, Dana, one of the things that we do at Fathers Incorporated, or we try to, at least we do it when we can. The federal grant didn't allow us to do it that way because it kind of flipped our curriculums around. We have two curriculums. We have a fatherhood curriculum, but we also have a life skills curriculum.
Mhm.
So what we do with our fathers is they have to go through the life skills curriculum before they go through the fatherhood curriculum, because the life skill curriculum sets the character stage: integrity, responsibility, kindness, empathy, understanding, emotional presence, all of those kinds of things, because those become the tools that you use in your co-parenting life. Because if you start with, let's say, communication, the first module in my, and it's not, but I'm just if the first module in my curriculum is communication and I run 10 guys through my communication module, I can't expect that they're going to go home and figure out a way to communicate if they don't know what respect is. But if I flip it and help them understand what respect is and the importance of respect, when I teach them communication, they'll communicate through the lens of respect.
Absolutely. I really wish that programs like this were available to everyone who's going to become a parent.
Right.
I think that in some of the ways that we do programming, sometimes I think, are we in the way, like if a father, sometimes within family court, they'll be told you have to go to this parenting class,
Hmm.
and it's a result of this case going to family court. And I wonder, is that, are we telling people like, hey, this course is because you're taking this course because something needs to be fixed in
Right.
you.
Or you're doing something wrong.
You're doing something wrong.
Right.
Rather than being more proactive and saying, hey, there's really not a handbook for this parenting thing. However, there are some skills that can make it, that could potentially make this transition smoother,
Hmm.
and how that might impact even fathers and mothers. And so, these programs, even for moms, if there are mothers who might be withholding access, do they really know the benefits that they are withholding from their child as well?
Wow.
A lot of fathers and mothers are unaware of what the research kind of connects to fatherhood involvement,
Hmm.
and some of those outcomes. And even when you talked about earlier the drop in teenage pregnancy, there's also been, when we look at the change over generations, there's been a significant increase in fatherhood involvement with
Hmm.
children. And so we know that active fathers delay sexual activity,
Hmm.
especially in girls. So if we're giving this information up front, if we're saying, hey, these are the complementary parenting style of mothers and fathers, and this is what mothers, you could give to your child. This is how important father's presence, might that impact some of the decisions that are made long term if we know more upfront, rather than kind of the way we currently do it is people just kind of become parents, and then if something goes wrong, then you might have to go to a parenting class, or you might have access. I know here in um, Baltimore, we have the Center for Urban Families, and they support a lot of fathers. Um, and there are a lot of men that I meet through research who are completely unaware that there are fatherhood programs available.
Right. Hmm.
And so, how can we normalize having this information, and approaching parenthood is not only a blessing, but also something where there are skills around it that you can learn, that not only can support your success in life, like you said, they have to take a lifestyle course first,
Hmm.
but then it could also positively impact both the parents and the children in the long term.
Yeah. You also have a component of your work that centers around storytelling as well. I thought that that was intriguing. Like, why is it important to tell stories to impact the narrative?
It is so that came about in a couple of ways. I was actually introduced to storytelling through one of my professors in my doctoral program. So his name is Dr. David Fakunle, and he is kind of a storytelling guru. And one of the things that he was explaining in the classroom was how storytelling connects more with people than statistics.
Hmm.
I mean, so we could say, 70% of this and this and that, but when you hear somebody's actual story of how something impacted them, it means more to us. And then when we think about, we are exposed to stories much more than we are exposed to data.
Mm.
And sometimes those stories kind of influence us to want to do more research, but oftentimes we get the story first.
Hmm.
And so when we talk about, one of the things that I have found in the course of my research is that when we talk about Black fathers, for example, there's research that shows that Black fathers, even after a relationship ends, they are the most likely to maintain active roles with their children.
Hmm.
And when I was explaining this to some of the fathers in my research study, they were actually surprised. Even though all of them were active and involved fathers, they were surprised that the data showed that, because all of the stories we hear
Right.
are about absentee fathers. There's actually a Baltimore Sun, they did an investigative report where they went and actually figured out how much past due child support is owed by zip code and things. So these are the stories we hear about fathers. It's mostly absent fathers.
Mm-hmm.
And that is so much into the minds of some of the fathers in Baltimore that they're surprised to hear positive research
Right.
about them. And so one of the things with this storytelling, we have started having fathers to tell their own stories so that they can connect with other fathers. And often that might be an inspiration to encourage other fathers to be even more involved. So we had an event in mid-July where fathers were able to come on stage and tell a 3 to 5 minute story about a time when they felt like were like they were doing this fatherhood thing. Like something happened, they're like, man, I'm out here. I'm father right now. And they were able to come up and like talk about their experiences, and we recorded it, and it's right now they're being edited and they're going to be released online as a campaign. But the process of thinking about the story, because some of them just go through life, they're just, and for the purpose of this, we actually said, hey, think about this.
Mm-hmm.
Thinking about it had a positive impact on them. But then when they were on stage, they were having this positive impact on everybody that, who was in the audience.
Mm-hmm.
There were people who were like, I had a poet who came just to do a poem. She ended up was like, I'm going to stay for the rest of the event. Like, I want to keep hearing these things. So it was impacting, others. And so the more stories that we can tell can help change that narrative. And then people might be inspired to challenge what they've been hearing and go to the research and, oh, we are out here, we are active, we are involved, and then that, like you said, once you start to feel better about yourself,
Right.
then your behavior changes.
Yeah. Just think that sometimes as practitioners, we spend a lot of time doing it. But I think many practitioners don't spend enough time and possibly may not even have enough time to continually ask why, right? Why? I don't want him to see him. Why? Because I'm mad at him. Why? Because he hurt me. Why? Like, why get you to the root, right? But if your um, motive is not to get to the root and to only remedy a behavior, you're never going to fix the problem, right? And so I'm not exactly sure sometimes how you humanize. And you would think that the social workspace is already humanized, but I don't think it is. I think it it focuses on humanity, but it's not humanized. Hu-
Yeah, I think we're operating in a system, right? And when we're looking to develop interventions and programs, our goal is often to figure out how can we serve the most people.
Mm,
And when you're thinking of um, large numbers, sometimes the individuals get lost
mm,
there. It is one of the main reasons why I like to really work with and tap into, I guess we call it grassroots organizations, because they do a lot of the work in terms of making sure that people aren't forgotten, individuals aren't forgotten. In the grand scheme of things, there's one group here, Dads United organization, Duo. It's run by a man, Michael Cornish, and he's been doing this for well over a decade.
mhm.
The work that he does with fathers in Baltimore, and then they have like the Black Daddy Gang. And so these organizations, they are, because they're grassroots, because they're smaller, they're father led, they keep that human element to it. And then whenever we need to be reminded, these are the groups that we often go to.
Mm-hmm.
There's another father, Eric Smith. He runs a nonprofit called Winning Strategies, and he supports fathers with navigating the system.
Mm-hmm.
But he does that because he did it himself. He went through the process. He, figured out how it worked, and then he created a nonprofit to help others. And so I think that the system itself is designed to serve the masses,
Mm-hmm.
and that's the space that it's in. And so that's why I really love that there are these community-led efforts, these grassroots efforts, and activities like storytelling to keep that human element and to make sure that their individuals aren't getting lost
Yeah.
in the big picture.
Incredible. Dena, you're doing some great work. I'm impressed. Like I said, I follow you, and I saw that event. When I saw that event, I was like, "Oh, that's dope." I was like, "I want to do one of those in Atlanta." I think I told Dr. Rollins, I said, somebody's doing something in Baltimore around storytelling. We got to figure out how to do that. We got to make that happen here in Atlanta. Um, I,
You,
I have
you,
this crazy idea, Dena, about this thing. I know I can't do it because you can't copyright it and you can't do it, and I might go to jail. I have this idea about DadX. Like we should do a DadX,
yes,
right?
I'm here for it.
Let's hold on. I'll tell Dot. I was actually just talking to her yesterday. We just saw her yesterday, and actually just spoke to her today, this afternoon. We should talk about like how we can like string together like possibly like 3 or 4 of those that happen in cities at the same exact time. So it's not like one off. So we say tonight is our Dad X night. There's one happening in Baltimore, one happening in Atlanta, one happening in Detroit, one happening in Dallas. And like we are flooding the internet market with the images of these dads telling their stories at these events.
That would be absolutely amazing. These the stories are going to be what do it. Like we do all this research, we have all this data, but the stories is what people connect with.
Yeah.
And those are things that can make changes. I mean, the first time I was exposed to you was at the Fatherhood Summit in Atlanta, with the dedication. You did a panel, and listening to you talk to those, I was okay. This is interesting. Like hearing the story, you didn't just get up there and say, "Hey, 70% of fathers so so." Like
Right.
you
Yeah.
exposed us to actual stories,
Yeah.
and so yes, more of that, and I'd love to be a part of it. Yeah.
Yeah. Wait till you see the new one we just did yesterday. Literally, what's today? Yes, no, we just did Wednesday or Tuesday. No, Wednesday. We just did Wednesday. And so we did a similar because the administration's changed and this administration doesn't want to see anything from the last administration and dedication is from the last administration. So we've had to scratch it. So my
Oh,
suggestion was let's do another one, not called the same thing, but the same idea. And literally, we had 4 fathers, all white, one from South Carolina, 2 from Kentucky, and 1 from Ohio, with varying backgrounds of things like substance abuse and those things. And so part of the long form was a similar conversation with me moderating it, talking to these dads. Man, that thing was so powerful. And what, you know, the theme of it was no matter what you go through, you can still do it. Like
mm,
there is no barrier that stops you from being a good dad. Like
yeah.
and so but this oh my goodness. It was an emotional day and I'm listening, I'm sitting in the middle of these 4 guys. I can't wait because I was saying that, when so often when we talk about fatherhood, it is always through the urban lens.
Yes.
And I said, in order to elevate this, we're going to have to broaden the lens, right? And so this was our way of really touching that rural lens,
Yeah.
which at the surface looks the same as the urban lens, but the issues are somewhat different, right? But the same things you hear in the urban communities about the aspirations of our dads and their desire to be the best dads they want to be to their children is the same thing you hear from these rural dads, right? So there is a theming.
Oh, I can't wait.
Yeah, well, there's a PSA is going to come out first, but the long form is not going to come out probably to early part of next year. We will be dropping we did like a day at the shoot because we was up in the Appalachian Mountains. We was on the mountains. The backdrop is, oh my goodness, when you see this backdrop we went to a farm. And we actually did the interview outside of the farm next to horses and, backdrop.
Ooh,
And
okay.
all that kind of stuff. So I'm really excited about it. But thank you. I really, really appreciate you. Let's connect. I'll make sure that Dr. Rollins know that I spoke to you and that we got this big idea that we got to get together and figure out how we're going to do it and when we're going to do it. Maybe we kind of think about it. Oh my goodness, I actually have an idea. I'll talk to you about it offline. Hold on a minute. I'll talk to you about it offline.
We have to get Chris White. I know you had him as a guest before. He has that Fatherly Love series.
Yeah. Absolutely. Thank you so much again. And thank you to all of my I Am Dad podcast listeners. You know how I like to leave you. Always be kind to yourself as you are. Always be kind to others as you are kind to yourself, or you might find yourself by yourself. Always shoot high for your goals, because even if you miss, you'll be amongst the stars. And as my mentor always said to me, Kenny, it's nice to be important, but you know what? It's much more important to be nice. Till next week, God bless, be safe, and peace out.
Thank you so much for taking the time to spend with us. You've been listening to I Am Dad podcast. We hope that you have been informed, encouraged you to think, or even inspired your heart for the love of dads. The conversation does not end here. Come back and join us next week. Same time, same place. Or you can continue the dialogue on our I Am Dad Facebook page. We also invite you to listen to past episodes, learn more about us, and keep up with special activities by visiting IamDadPodcast.com. That's IamDadPodcast.com. Until next time, I leave you with this reminder of manhood from 1 Corinthians chapter 13, verse 11. When I was a child, I spoke as a child. I understood as a child. I thought as a child. But when I became a man, I put away childish things. Because of this reminder, I will always understand that I am dad, period.
Yeah.